Yeah, I see you now, right here.
Busy Los Angeles model and entrepreneur Toy Arnold is searching for the best health care in America.
A major job putting all of this together to make this happen.
After months of research, Toy expects to find the best American health care
I'm ready.
in Bangkok, Thailand.
I'm suffering from fibroid tumors. The problem is, with insurance nowadays, if it's a pre-existing condition, they won't cover you.
Toy's medical treatment in Thailand began here, in Los Angeles. Dr. Bruce McLucas is the pioneer of a minimally invasive procedure for uterine fibroids. He is an OBGYN and an assistant professor of medicine at UCLA.
Ms. Arnold is suffering from two problems. One is severe fibroid uterus, uterine myomata. The other one is lack of insurance. And like millions of other Californians, this makes it very hard for her to get health care. We were able to give patients an option of traveling to Thailand, where we're able to do surgery along with the Thai doctors and save them a lot of money, even with the trip to Thailand included.
Toy traveled to Thailand with Meds Global Healthcare, a Los Angeles-based company establishing centers of medical excellence with a network of the most respected hospitals around the world.
The doctors in Thailand are wonderful doctors, very well-trained doctors.
Uterus, multiple masses.
In fact, the angiography suite that we used for Ms. Arnold's procedure was a little bit more modern than anything I've seen here in Los Angeles. So nobody's getting second-class care for a discounted price.
The mission of the company is really to provide access to high-quality health care that's affordable for patients worldwide. Most of the doctors who work with us are U.S. board trained and certified. They've completed their full residency and fellowship at U.S. institutions, many of the leading institutions in the U.S., such as Harvard, Mayo Clinic, Cleveland Clinic, as well as UCLA.
So we're going to get them all tomorrow. That's the nice thing about embolization. It gets the little ones.
Dr. McLucas trained a number of physicians over there in obstetrics and gynecology, as well as interventional radiology, on the pros as well as the cons of his procedure.
Toy's large non-cancerous tumors in her uterus cause excessive bleeding, anemia, cramping, and infertility.
It's a firm mass.
Toy did not want a hysterectomy or myomectomy, major surgery to cut them out. Toy believes the minimally invasive procedure called the uterine artery embolization that Dr. McLucas pioneered in the U.S. will give her the best chance of having a child.
I might have been a little apprehensive about having the procedure done in Thailand. Although I'm going to Thailand, he will be performing the procedure. So I'm a cash patient, and he shared with me the opportunity to go to Thailand and to save a phenomenal amount of money.
Here at Sirirat Hospital, a university hospital in Bangkok, Dr. McLucas works with the Thai doctors he has trained in the technique.
Uterine artery embolization is a major breakthrough for women suffering from a very common problem, uterine fibroids. No, that's a great picture. It's a non-surgical way of shrinking the fibroids. Under X-ray guidance, we'll put small particles into the uterine arteries on both sides. This is how I do it, okay? We block the blood supply, and over a course of 6 months, the fibroids shrink 50%. They never come back. It's a beautiful machine. It's much nicer than what we do this on.
What everyone is looking from a hospital is the medical quality, service quality, and cost quality. We are quite open to every doctors from countries all around the world. So we are very happy that someone from the state visit us and would like to collaborate with us.
In Thailand, they have very high quality care to begin with, but with state-of-the-art technologies, some of which they are not accustomed to because they've been developed here in the United States. We've taken over the thought leaders who have established these programs here in the U.S. and taught the local doctors in Thailand. And I think this is beneficial not only for patients in Thailand, but also can benefit many U.S. patients who can afford similar care here in the U.S.
Thank you so much for everything. You're sweet.
Our primary mission is to look after the Thai patients. But if it is possible and we have spaces, that we would like to care for all patients who would like to come.
More and more individuals are being asked to cover or be responsible for their own healthcare costs. The consumer-driven health plans, and that trend is going to empower individuals to make decisions about where they want their health care and who should be delivering that.
Toy's procedure in Thailand cost a fraction of that in the States, but included airfare, executive ground transportation, a luxury hotel, and a patient liaison to accompany her.
You see the pool right there?
A procedure that would cost $50,000 here in the United States typically will run about $10,000 to $15,000. It's really for patients who fall into two main categories: those patients who are uninsured, who can afford paying the cash prices here in the U.S., or those who are underinsured. And what I mean by that are the patients who have insurance but have very high deductible and copay, so that their out-of-pocket expense, even though they have insurance, is still going to cost them more than going to Thailand for the same procedure.
After the procedure, after Toy checked out of her hotel, we drove to Bangkok Airport and were able to experience Phuket, which is an island on the southern part of Thailand. We were able to go on a tour of the southern part of the island to visit the different beaches. We went on an amazing elephant trek in the jungle. So luckily for Toy, she was involved in a procedure that wasn't too invasive and she was able to recover quickly. So we had a wonderful time. She has some wonderful memories.
I'm not a politician. I don't have the governor's solutions for improving health care overall, but one thing we can do, say to one patient at a time, is allow one person who would never have surgery to get it. That's gratifying. I'm happy I was part of that.
Oh God, it was incredible. It was a very memorable experience. And the whole trip, the experience of the procedure, everything was wonderful. It was wonderful.